Since 1937, Mako has been one of the leading manufacturers of audiological equipment. Mako's most recent development is a new impedance system called touchTymp. This product marks the beginning of a new middle ear analyzer generation. Locate the color-coded jacks on the back of the instrument to start the setup of your device. First, take the power supply and connect it to the back of the instrument. The pen probe comes specifically calibrated for the base unit and can be used right away. Attach the probe by gently pushing the connector into the jack labeled probe. The brackets to the left and right of the jack will close automatically, and the probe will sit tight and safe. To turn on the touchTymp, press the blue button on the front of the device. The touchTymp will load the settings, and once completed, the home screen is displayed. At the bottom of every screen, a static toolbar is displayed. The toolbar is viewable on every screen. The touchTymp has a variety of custom settings to modify the standard protocols within the device. Some examples include displaying a normative box for the tympanometry results, or a pass, no response indicator upon completion of the test. Take the probe out of the cavity to start the selected module immediately. The selection of the appropriate ear tip is necessary for the measurement to be completed. Within the included ear tip box, there are multiple sizes for selection, as well as 2 distinct shapes. To select the appropriate size of ear tip, gently pull the ear up and back to straighten the ear canal. The ear tip should cover the entire ear canal opening, but not be too big or too small. When placing an ear tip on the probe, make sure the ear tip is pushed all the way down on the probe tip. Gently pull the ear up and back for adults, or down and back for infants, to straighten the ear canal. Hold the probe in place, applying slight pressure so a seal can be obtained throughout the test. The light bar at the bottom of the probe provides a real-time progression of the test. This function allows you to focus completely on the patient. After successful completion of a test, place the probe into the cavity and the results will print automatically. This function is only enabled when the device is purchased with an integrated printer. To clean the probe tip, first unscrew the probe cap by turning it in a counterclockwise direction. Never clean the probe tip while the tip is still attached to the probe. Take the plastic probe tip out of the probe and take the cleaning tool apart to find the thin brush and thin rigid plastic cord. Use the plastic cord or brush to push debris out of the probe tip. Always enter the probe tip from the rear to avoid accumulation of debris inside the vents. Place the probe tip back, making sure that it is inserted appropriately onto the probe. The force of tightening the cap will tighten the screw sufficiently. A contralateral acoustic reflex measurement can also be performed with the pen probe. As this function is not standard on all devices, verify the contralateral headphone included with your purchase. Connect the contralateral phone to the yellow jack labeled Contra. Place the contralateral phone carefully on the opposite ear of where the probe is placed on the patient. Hold the probe still until all measurements are finalized.